everything's changed, like everything. We basically think in the ER, everybody's got COVID. That's how we think now.
This whole other level of thinking about what we're doing, added to what we already do.
There are a lot of very, very sick people. The mortality is very, very high.
As governor of New York, I am asking healthcare professionals across the country, please come help us in New York now.
Just got out of a shift here at New York Presbyterian Queens. The rates of infection are high. We assume that everyone who is coming into the hospital has a complication of COVID. There is a significant risk to people who are in the front lines.
Our older kid, the journal entry went from me fighting the coronavirus to me being sick in a hospital bed from it. And so it's definitely on all of our minds. I'm concerned we're going to start seeing a spike as people get fatigued with being stuck inside. The weather's getting nicer.
If people don't stay vigilant, there could be another spike. This is a marathon, not a sprint.
Hey doctors and nurses from UCSF, just want to send a special message and shout out to you guys. It's unbelievable, the sense of sacrifice and selflessness. We couldn't do it without the work and the sacrifice of people like you. So safe travels, all the best.
My name is Clement Ye. I am a clinical professor of emergency medicine at the University of California, San Francisco in the Department of Emergency Medicine. Physicians from various departments within UCSF, as well as 8 nurses with a lot of expertise.
How's New York? What time is it over there? Maybe 12:30 now?
It's 12:30 here now. I've got a shift starting. Hey everybody, just got out of a shift here at New York Presbyterian Queens. The team here is great. Conditions are getting better every day. Still a lot of sick people I was taking care of today. I am assigned to a team for a certain shift, managing, various patients in the ED. As an emergency physician, we are used to a lot of uncertainty, and this is to a whole nother degree. What I am seeing is very new to me, but it is not new to the doctors and nurses and personnel that have been here dealing with this for many weeks. I think right now I am really just trying to take it all in and learn the processes. But I think right now I'm kind of more girding myself for a long haul. I'm here for only a few weeks, but what I am seeing is that just like everywhere else, I think this is going to be this is a marathon, not a sprint. There is a long way to go still, and a lot of continued sick patients that we're going to be taking care of for some time.
Okay, move, everybody move.
What I'm seeing is that there are many people who are so sick, they may not be dying immediately, but the prognosis is very, very poor. For many of the most vulnerable people in society, the mortality, particularly in the very elderly group, is very, very high. Palliative care, that is end-of-life care, we are finding that our palliative care teams, both at home in the Bay Area, at UCSF, but also what we're seeing here in parallel at New York Presbyterian and in New York City, are really being challenged just by the volume of end-of-life discussions and amount of end-of-life care that's happening.
Are you having to make those hard phone calls to family members?
Yes. Those are some of the hardest phone calls to make, are to explain how sick and how in trouble loved ones are to people who cannot physically be there. Even with video conferencing technologies, even with whatever we can try to do for communication, it is tremendously sad to not be able to have people at the bedside of their loved ones.
I was like, breathing like that.
My sister is a medical professional in New York City, and she recently tested positive for COVID-19. Is that a concern of yours, that you might get infected?
We understand that there is a significant risk to people who are in the front lines, who are being exposed. And what I have seen is that infection control measures are very high and very strong here. At the same time, the risk is continuous and something that is a very high concern, I think, of everyone.
One of the things that my sister mentioned, she said, my boss is asking me to come back to work once I don't have a fever. Is that something that you're also seeing over there?
Yes, it is. It's the type of thing where we are following the latest guidelines and understanding about this disease to know when people are well enough to come back after a prescribed time period without fevers, and also not taking any medication to control fevers. And then at a certain time point after initial infection, we believe that people can come back and work safely. We need to have people who are able to continue. We need to be able to have people on the front lines who are safe and who can continue to care for others, because if we lose that, it's going to be a real problem. I think I have a sense of gratitude. I think that I am here to support the team. I am here to help as much as I possibly can, and I am here to be safe. I am here really only through the support of my healthcare worker, professional colleagues who are keeping everyone safe at home, and through the support of my family that are allowing me to come and help out. And I feel very grateful to be able to do that. I think if we do the right things now, it will be much shorter, even as our numbers are hopefully stabilizing and things are getting better day by day. We still need to stay on the gas, if you will. If people don't stay vigilant, there could be another spike.
What do you think the Bay Area did right in response to COVID-19?
Everyone is always asking, what's going on? Why are things, looking okay right now in the Bay Area? What were the decisions? What were you seeing there? How is it different? I can say confidently is that we have very strong public health leadership that is responsive to data and expertise where it needs to be. And I think we have a very committed and willing community. I think people understand and are willing to undergo some part of personal sacrifice for a better common good. The Bay Area is being seen as a model for how to get things right and how to do things right. So to all of my people there, both professionally and personally, keep it up. Great job. Stay on it. Take care of yourself and be safe.
My name is Krista Chavez, and I am a pediatric neonatal critical care transport nurse for a hospital in San Francisco.
My name is Tim Wyatt. I am an emergency department nurse practitioner in San Francisco.
I go out to hospitals around communities all over California and neighboring states and bring critically ill patients back to my hospital for further care. We go via ambulance, helicopter, or airplane.
I work in the emergency department, and most of the time in an observation unit. It's for emergency department patients that are too sick to go home, but not quite sick enough to come in the hospital. So a lot of undiagnosed or confusing diagnostic pictures in patients. Lately, I've been in the tents that are out in a parking lot for screening COVID patients.
Initially, I think it made all of us, my teammates, think, how would we do our job differently? How are we going to keep ourselves safe? We have lots of moving parts in our job. As the science started coming out about COVID patients and what that disease looked like, we were all trying to figure out what the newest and best recommendations for managing a patient on a ventilator was. And as it's worn on, just staying up on that and staying up on all the latest that our facilities telling us about, but then also what the science is.
I would say everything's changed, like everything. Like how I go into the emergency department's changed. How I use my hands, like what do I touch? And do I use my left hand or my right hand? Or, you know, where am I possibly picking up COVID? Is it the doorknob? Is it the mouse? Is it the microwave oven door in the break room? So you get a little paranoid after a while. So it's just kind of this exhausting exercise of examining everything you do that you've been doing for, you know, I've been in the ER for 25 years. I have to relearn everything from scratch.
You know, if we're taking care of a very sick patient, you know, you have to kind of do the best you can, but it's very different world to walk into the hospital when you're out here in the world, in our house, in our neighborhood, thinking about all that social distancing. And, you know, our facilities do an amazing job, but it's a lot to kind of think about while you're also just doing your typical job, which is intense at baseline.
If I'm going to see a patient who we're concerned may have COVID, surgical mask, the face shield as before, but a gown and gloves as well. If they're high risk, so if they're getting treatments that would aerosolize virus, then you can move on to N95 or even like the full face like helmet that's got filtered forced air. And after 12 hours of having all that on, it's really nice to take it off and be outside and have the wind blow on your face. We basically think in the ER, everybody's got COVID. That's how we think now. The challenge with COVID is there are a lot of people who look pretty good, and they could test positive, or they could look ill and they could test negative. So we always have to think about, you know, not having a false sense of security when a test is negative. And you just have to, at the end of the day, you look at the patient and like, how are they doing? What's their situation at home? If they get sick, you know, outside the hospital, they can be okay. So if they're homeless and have schizophrenia and they're COVID negative, but they're concerning, you know, we're concerned about them, we may keep them.
It's this whole other level of thinking about what we're doing, added to what we already do. And I think that's the main thing that it's changed. Thankfully, California has done a pretty amazing job of flattening the curve. And so the surge that we had feared would happen hasn't happened. And hopefully it doesn't. Our kids are, you know, seeing concerns about us getting sick and dying pretty quickly. And so we started the journals, and our older child loves history. And one picture I shared is me in a Florence Nightingale outfit. You'll notice the date is 1800. And then our other child drew a picture of Pokemon beating the coronavirus. For whatever reason, our older kid is really worried about me getting sick. They think Tim's invincible, I guess.
He's expendable.
No, but it's, we're concerned. I mean, it's, I don't know if you can only carry so much of that concern while you're also carrying the, you know, the intensity of the job and homeschooling 2 kids and we're solo parents, because when one person's down there, you're solo with the kids. And so in the beginning, it was a huge stressor, I think, for both of us. And I can speak for me personally, it was pretty anxiety inducing to think about coming home and giving it to the kids and giving it to Tim, especially since I'm in pediatrics. And so they're often the silent carriers. I was pretty concerned that we would be taking care of a patient that had COVID that we didn't realize. But I think as it's worn on, it definitely is back there. It's this low level stress that's always there. It's popped back up with our older kid. Journal entry went from me fighting the coronavirus to me being sick in a hospital bed from it. And so it's definitely on all of our minds. We wipe down, we change our clothes, we wipe down our shoes and then take them off. We have one car that's the work car, and so our gear, stays in there or it doesn't even come home. I'm grateful to be able to be out there and to be helping, and we both love our jobs, and so I'm grateful for that. It's also really stressful to think that we're going out and exposing our family to that, and because we both are essential workers and we're both out there, we can't just send one of us away to go work and to isolate, which is hard. It's hard that's the situation, is that one of us couldn't just go out there and just do it and stay away. So we don't have that option.
For my own sanity, I'm telling myself it's going to get worse in the hospital. It's going to get busier and crazier, and it's going to be. We're going to have to ramp it up. Tomorrow, you ask me, and I'll give you a different answer. That's kind of the way life is.
I'm concerned we're going to start seeing a spike as people get fatigued with being stuck inside. The weather's getting nicer. I don't know that I'm as optimistic as some people, but I think Tim and I are similar in that way, that it could get bad at any time, and hope it doesn't. Can't always let your guard down, but that's many years in the ER.